Navigating through Medicare.
Hi, my name is Jennifer Melton with Navigating Medicare. I love helping people understand Medicare, and that's what we're going to do today. We're going to talk about the parts of Medicare, Original Medicare, Medicare Supplement plans, Medicare Advantage, Part D, and some questions that you may have. Also some next steps. There are 4 parts of Medicare: Part A, Part B, Part C, and Part D. Part A helps pay for your inpatient care, Part B helps pay for your outpatient care, and Part D is a prescription drug plan, which helps cover your prescription medications. Part C is a Medicare Advantage plan. It includes A, B, and sometimes D as well. To qualify for Original Medicare, you need to be 65 years old or under age 65 with a qualifying disability. You need to be a U.S. citizen or a legal resident for at least 5 years. For enrolling in Medicare, you have a 7-month window. It starts 3 months before your birth month, it includes your birth month, and 3 months after your birth month. If you choose to continue working after you turn 65 and you have credible coverage, and you decide to leave that coverage, you have 63 days to enroll in Medicare A, B, and D to avoid a penalty. Enrollment in Medicare Part A and B is automatic if you're already receiving a Social Security payment. You're entitled to Part A at no cost as long as you've worked and you've paid in your 40 quarters. Part A has a deductible of $1,556. That covers you for 60 days. If you were to stay in the hospital for 1 day or the whole 60 days, that is your deductible for Part A. Now, if you go back into the hospital later that year, you may have to pay that deductible again, which is not like the traditional calendar year deductibles that you're used to. The coinsurance for days 61 to 90 is $389 per day. For days 91 to 150, it's $778, and beyond days 150, you will be responsible for that yourself. Skilled nursing is also a benefit under Part A. The first 20 days are covered 100% by Medicare Part A. After the 20th day, you pay $194.50 per day. Medicare Part B has a calendar year deductible of $233. After you pay your deductible, Medicare pays 80% and then you pay 20%, and there's no maximum out of pocket. The premium for Part B is $170.10. It could be more based on your income. Medicare looks back 2 years, and if your household income is over $182,000 a year or your individual income is over $91,000 a year, your premium would be higher. You can find your income on this chart, and that will show you what you can expect to pay for your Part B premium each month. Most people add additional coverage to limit their out-of-pocket expenses each year. The first type of coverage we're going to discuss is the Medicare Supplement. Sometimes referred to as Medigap plans, Medicare Supplement plans are secondary to Original Medicare. Medicare pays first, and if Medicare allows that charge, your supplement will help pay the rest. They have a monthly premium that you pay in addition to your Part B premium. And there's no network, so as long as the provider accepts Medicare, they will accept your supplement. Medicare supplements do not include prescription drug coverage, so you'll need to add that in a separate plan. We'll talk about prescription drug coverage in more detail later in the presentation. There are several supplements available, and they vary in the amount that they pay towards your 20% and your deductibles. For example, a Plan G would cover your inpatient Part A deductible and the full 20% of your Part B cost, in or out of the hospital. You would be responsible for the Part B deductible of $233 per year. If you had a Plan G and you had $1 million bill at the hospital, your portion would be $233 plus the premium that you pay each month. Keep in mind that a Medicare supplement will increase your flexibility and lower your risk. However, it does come at a higher premium that could increase over time. Another option you have is a Medicare Advantage plan, also known as Part C. Medicare Advantage plans take your Part A and your Part B and usually add Part D under one umbrella. There are no health questions to qualify for a plan, and there's little to no premium. You have to live in the plan service area, and you have to maintain your Part A and your Part B of Medicare. Every Medicare Advantage plan has a maximum out-of-pocket, which is one of my favorite things because you know that there's a cap to what you're going to pay. They also have a fitness program. They can include dental, vision, and sometimes hearing, and they all have worldwide emergency care. There are different types of Medicare Advantage plans available. And the county that you live in will determine which plans you have access to. So it's a good idea to look at your specific zip code and find out what plans are available for you. Here's a visual to show you what we've just talked about. Medicare Advantage is able to cover your vision, dental, hearing, and out-of-pocket spending limit all in one plan. With Original Medicare and a supplement, if you want vision and dental, you would just add that in a separate plan. And on the far right, you will see Original Medicare, which will cover a portion of your medical expenses, but it does not have a limit to what you could spend out of your pocket, and it doesn't include the extras like prescriptions or vision or dental or hearing. So you would need to enroll in those separately. The next thing on our agenda is Medicare Part D, which is prescription drug coverage. First, I want to mention the cost of Part D. Similar to Medicare Part B, if your income is over a certain limit, you may pay extra for your Part D plan. This will apply to you if you have a standalone Part D plan, as well as if you have a Medicare Advantage plan. Medicare creates a blueprint for prescription drug plans that all the insurance companies that offer them have to follow. They lay it out in stages. You have a deductible stage, an initial coverage stage, the coverage gap or the donut hole, and then you also have the catastrophic stage. The first stage is the deductible, and the deductible for 2022 is $480. You pay 100% of the cost of your medication until you reach $480. Next, you enter the initial coverage period. During that time, you pay your part, which is your copay or your coinsurance, and the insurance company pays the rest. Now the insurance company during this time is going to keep track of everything that they spend and everything that you spend. When that total drug cost reaches $4,430, then you've reached the coverage gap or the donut hole. Now, instead of paying your copay or your coinsurance, you're going to pay a flat 25%, whether it's a brand name or a generic drug. When your total out-of-pocket cost reaches $7,050, then you go to the next stage. But I don't want to get there yet. Some people think the difference between the $4,430 and the $7,050 is all you have to pay. They only take into account what you have paid out of your pocket. So if you paid your deductible and you paid your copays, then you get to start the coverage gap with that amount, not the $4,430. So now you're going to pay for your medications at 25% until you reach your out-of-pocket of $7,050. The discount here is coming largely from the pharmaceutical companies, and Medicare allows you to credit that discount on name brand drugs towards your out-of-pocket cost. So if you take a name brand drug, it may help you get through the donut hole a little faster. Once your out-of-pocket costs have reached $7,050, you will go into the next stage, which is the catastrophic stage. During this time, you will either pay $395 for generic drugs,
$985
for brand name drugs. Once the year is over, then this wheel starts over again and you'll start back with your deductible. Now we're going to talk about some terms for Medicare Part D. Every prescription drug plan has a tiered formulary. They go from Tier 1 to Tier 5. Tier 1 being the lowest cost and Tier 5 being the highest. The next term is step therapy, which requires you to take one or more similar lower cost drugs to treat the condition before the plan will cover the prescribed drug. It really does protect your pocketbook and the insurance company. Some medications have quantity limits, so plans may limit the amount of prescription drugs they cover for a certain period of time. If your medication is not listed in the plan's formulary or you're needing to take more than the quantity limit, you can request an exception. Every prescription drug plan also has a network of pharmacies. Make sure that the pharmacy that you prefer is listed in your plan's network. Here are some important things to know. You could incur a penalty if you do not enroll in Part B and Part D when you're first able to do so. Credible coverage gives you a special election period to enroll at a different time. It's important to know that custodial care is not covered by Original Medicare, Medicare Supplements, or Medicare Advantage plans, so you might look into getting a short-term or long-term care plan to cover those future expenses. In addition to the plans we've talked about today, there are other plans that can assist you in paying your copays or your coinsurance. No matter which plan you choose, there can be gaps that leave you paying copays or having out-of-pocket expenses. There are extra plans offered to help with those expenses, And these gaps could be hospital copays, skilled nursing care, and unexpected costs that come with cancer, heart attacks, or strokes. The plans that we have to fill those gaps are known as indemnity plans. These plans pay a specific amount for services or illnesses to help cut back on your financial responsibility. We've listed some questions here that we often get. The first one is, what if I work past 65? As long as you have coverage through your group insurance or someone else's group insurance that can be considered credible coverage, you can delay your Part B until you're ready to retire. You just need to make sure that you talk to your company's group coverage administrator or human resources to make sure that your coverage is credible if you're unsure. What if your spouse is younger than you and covered under your group plan? The best thing that you can do is talk to your group's administrator and find out if there's an option for them to stay on your plan. If there's not an option for them to stay on your plan, when you go on Medicare, it will affect your spouse's coverage. What if you plan to move? If you decide to move, that will initiate a special election period for you to change your plan. Just remember, we talked about how a lot of these plans are specific to your county. So whenever you move, make sure that you pick a plan that's offered in your service area. What if you travel frequently or you have 2 homes? There are some plans that are more suitable for someone who travels a lot or has multiple homes, so make sure you mention that whenever we meet. Can I choose my own doctors? The answer is yes. Now, depending on which plan you have, you may have a selection of doctors to choose from, but you get to choose. Our goal is to make sure that the doctors you use and the medications that you use are able to stay the same no matter which plan you choose. Is there financial help available? Yes, there is. There are a couple programs that you can apply for. There's Medicare Savings Program that can help pay for your Part B premium and some of your coinsurance. And there's also a program called the Extra Help Program, and it helps with your prescription drug costs. If you find that you need help, reach out to us and we can help you apply for them. If you have Federal Blue Cross and Blue Shield, it is not credible for your Part B once you retire, so make sure that when you retire, you go ahead and add Part B at that time. What if you're a veteran? First of all, thank you so much for your service. Your priority group will determine the level of benefits that you have with the Veterans Administration. The coverage that you get for prescription drugs is credible, so for Part D, you do not have to get a plan if you don't want to. You won't be penalized if you choose not to get one. On the health benefits that you get through the VA, they are not considered credible for Part B. So you do want to go ahead and get your Part B when you turn 65 or when you leave your group coverage. Now we're going to talk about some next steps for getting set up with Medicare. The first thing you need to do, if you haven't done it already, is register for a Social Security account. And after you've done that, you'll be able to enroll in Parts A and B online. Once you enroll in Medicare, you'll get a Medicare number, and then you can also sign up for a mymedicare.gov account. If you choose to continue to work and just enroll in Part A, you're able to do that online as well. The next thing you want to do after you enroll in Medicare is to choose what type of plan you want, and that's where we come in. We do not charge for any of our services, and there's never an obligation to enroll. We're paid by each insurance company to be your agent and assist you going forward if you choose to enroll in a plan. You can call us at 405-842-0494 and schedule an appointment for us to help you out. We're at 2232 West Hefner Road, Suite A, and we're right by the post office. We have agents all over the state, so we can come to you if you would prefer. Again, our number is 405-842-0494, and you can visit our website at navigatingmedicare.com. Thank you so much for watching this video today. I look forward to seeing you soon.
Navigating through Medicare.